Hey, what's up? I'm going to get a little maintenance done here. We're going to see Dr. Martin Skopp. He's a chiropractor who also does work with ART, Active Release, and also SASTM, which is Sound Assisted Soft Tissue Mobilization, I believe. He'd have to verify that. But basically something that I try and do every 2-3 weeks, or as soon as I feel something going wrong. Like sometimes you can feel something get real tight or a little twingy, doesn't feel right. Get it checked out ahead of time and try and avoid an injury down the road.
Is that a new shirt?
Oh yeah, my new EC training shirt.
Oh, cool.
See it?
Nice.
Let the torture session begin.
Are you going into beauty accent or?
Beauty accent?
I thought you were getting a pedicure done today.
I get a beauty accent after I go.
Oh, okay. Gotcha.
That's my reward for going here first.
All right.
Yeah, so these are still bothering me. Both ones actually. It's still kind of like the hammer curl or the any kind of work that feels it's like a sharp pain in here. The other thing I noticed is anytime like when I put it in a stretch position, like on the preacher curl, the incline bench, any kind of stretch, I get a sharp pain down this region as well.
So that's where you're feeling it.
Yeah.
Yeah, I can feel there's a little bit of tightness right in there. I'm going to start right there. And what I'm feeling is a bit of a stringy, ropey sensation right along the brachioradialis here. And so I'm doing a couple of passes here to try to break apart.
Does it hurt
the scar tissue
when he does that, Jason?
This is nothing. Wait till he pulls out the tools.
Yeah.
Then that's fun.
Okay.
This is the preliminaries.
Yeah.
Gotcha.
Hurt a little now, so it feels better later. And you can function better later. That's the more important thing, right?
So is Jason one of your more challenging patients?
Oh, he's not challenging at all.
No.
He's easy.
Oh, okay.
He's one of my bigger patients. Again.
So I guess you work on all different types of people, athletes and just the average person?
I work on athletes, I work on grandmas, weightlifting grandmas, of course. Yes, I work on pretty much different age groups. Whoever's got muscles, fascia, ligaments, tendons, that's who I work on.
Right. So what's the difference between active release and, say, massage therapy?
Well, in active release, you can see there's movement involved.
Right.
And what the movement does is it allows us to get in there and break the fibers up as they're dynamically stretching. With massage therapy, you're getting good blood flow and lymphatic flow, but you're not addressing the scar tissue, the adhesion fibrosis. And a lot of people don't know that there is adhesion fibrosis, but here's a picture of a normal ligament, right? And here's a picture of the ligament after the adhesion fibrosis forms. You feel that piece right there? There's a little piece that feels really leathery. Assisted soft tissue mobilization tools developed by David Graston.
They look innocuous, but those things are little torture devices, let me tell you.
What they do is they really help further break up some of that scar tissue. They work a little differently. You can sometimes get a little bit of bruising with it, but you can get in there a whole lot deeper. And sometimes you can, with these tools, both the patient and the doctor can feel the crunchiness, we'll call it, or
feels like all grisly.
Sometimes there's a sound, that's why they call it sound-assisted soft tissue mobilization. Sometimes you can really hear that kind of sound. Here's the fun part. So I'm getting a little deeper in there now.
That's the fun part.
And you can find the different directions where the fibers are going. There it is. And if I incorporate a little bit, good, and straighten your arm. Okay, let's bring it. There you go. So we're sort of using a little bit of active motion with the tool. Yeah. Okay.
All right.
So how can people get in touch with you, Dr. Skopp?
Well, they can call us at the office at 703-721-9600, or you can look out on our website at www.skoppchiro.com.
Great.
Today I was a little doggy.